Go.
In this section, we want to talk about knee pain. And again, the knee is kind of as complex as the low back. There's not a lot of structures in there. It's a really interesting joint. It has ligaments that provide a lot of the stability. And sometimes it's hard to get a really good diagnosis about why we would have knee pain. If you're have a strong athletic background or you're older, you may have been told that you have arthritis, and it's generally tends to be an all-encompassing type of diagnosis. So you sort of say, well, I've got arthritis, that's why my knee hurts. And sometimes that's not a very good diagnosis because we'd like to delve a little deeper into why. The good thing is the Genesis Health Light, again, will work very strongly and very effectively to help with inflammation, pain control, and tissue repair. So if there's tissue that's damaged in the knee, it will help repair that. If you have repetitive inflammation, so if you use your knee and it swells up, or you play a game of golf and your knee is hurting, if you're playing sports, whether acute or chronic pain, the Genesis Health Light can help with the knee. A couple things to consider when we're treating the knee with the Health Light is that we would want to treat and get the most effectiveness by coming in from the side. So we're not going to want to treat right over the kneecap. We're going to come in from one side or the other side. So lateral or medial, that's where we want to treat. We want to come in this way. Okay? The other thing that we want to remember is that there's a very strong group of muscles right above the knee. Okay? The quad muscles. The quad muscles all use the knee as a lever to go over and give you the power and the mobility that you enjoy. So if you're having knee pain, make sure you take the time to palpate around the knee, behind the knee, and above the knee to find out if you've got some muscle pain there. Because we would also want to treat the muscles directly above the knee and the kneecap. And if those muscles are not inflamed and not in pain, there's probably a better chance you're going to be using your knee correctly and that pain is going to go away. Sometimes in kids, especially during a growth phase, they're going to have pain below the knee. This is where the tendon attaches to the bone. It's a very common condition called Osgood-Schlatter's disease. Really fancy name for saying that they've got basically a bone inflammation and a tendon inflammation. It's on the little bump below their kneecap. And again, the Genesis Health Light is perfect for this application. You can apply right over the tendon and the attachment point on the bone. You can use it in kids, soccer players, squash players, and treat their pain. So we know that this inflammation in the specific diagnosis of Osgood-Schlatter's disease isn't going to go away fully until they're skeletally mature, until their bones actually fuse up. So when they have pain here, we can use the Genesis Health Light as a maintenance tool and as a pain management tool. For us as adults, wherever we're feeling the pain, we want to enter the knee from either side, and we don't want to forget to treat above the knee also. So when we're using the Genesis Health Light to treat the knee, again, we're looking at 7 to 10 minutes on either side. If you've got any tenderness above, we would want to use 7 to 10 minutes here also. If you're treating on the low setting, because if you've got darker skin or you find that you're sensitive to the light at all, then you're going to use the lower setting. Then you're looking at 10 to 12 minutes using the same placement. So treating the knee is actually physically very easy. You can use a sitting position like this. You can do it lying down. Or again, you can check out the website and see which stand you may want to purchase that would be right for you. So if you're using the Health Light to control acute or chronic pain or inflammation of the knee, you could treat twice a day. And again, 7 to 10 minutes on high, 10 to 12 minutes on low. If you're treating 7 to 10 times and you find you're not seeing results, that's when you want to go see a healthcare practitioner to make sure you've got the diagnosis correct or there isn't something more serious going on.